What's up, everyone? Welcome back to another episode of the GSD Show. I'm Mike Arce, and we are doing a random bonus episode because there is a big scare going on for fitness studios, a lot of businesses actually, around the coronavirus and how that's going to affect them.
The coronavirus outbreak.
The coronavirus.
Coronavirus.
The news about coronavirus.
Breaking news now, let's get to it. It has to do with COVID-19.
And their companies and their members, and we wanted to be able to get you some information as quickly as we possibly can because I've been getting more messages than I can handle right now, and I wanted to be able to get on top of it. So today I've got Dr. Janice Johnston. Janice, you are, Dr. J, you are the owner of Redirect Health and also Arrowhead Health Centers, and a good friend of mine. I've known you for a while. You're one of the best doctors here in Arizona. Tell me a little bit more about your background, you know, how long you've been in the industry and what you've done.
Yeah, sure. So I'm a family physician. Was trained and born in Canada, Toronto. So you might hear that in my voice. Moved here in 1995 to Arizona and set up primary care here, along with my husband, who's a chiropractor. And we've had several primary care clinics here in the Valley for many, many years since that time. About 6 years ago, we started Redirect Health, which was our way of reaching small businesses, individuals, and associations who are really worried about the cost of healthcare to be able to bring to them a very affordable, accessible form of healthcare to their team and their staff and themselves without footing the bill for huge health insurance costs. Yeah.
Right. Yeah, and we use Redirect Health here, and it's awesome. And between Redirect Health and Arrowhead Health Center, how many patients have you guys served?
Well, that's a really good question. I know it's well over 2.5 million. It might be over 3 million at this. It's
3 million patients.
Yeah, something like that.
Wow.
I think we're kind of like McDonald's, you know.
Yeah. Awesome.
Yeah.
So, the coronavirus. Let's talk about this. What is the coronavirus?
Right. So coronavirus has been around for quite a long time. There's different subsets that have been around. This is a novel one, meaning it's a new one that hasn't been seen before. So it was just identified in China.
Okay.
Thought that it came from bats, actually, and people that were exposed at it was a market, and so they think it might have come from meat or something and transmitted from the meat to people. And now, of course, we're seeing that its transmission is from person to person. So it's what we call a novel coronavirus. So it's something that's been newly identified.
Okay, got it. And so talk to me about, like, you know, it started out in China and it worked its way through Europe. Italy got hit pretty hard, and it first made its way into the U.S. like, what, 2 weeks ago or something, 3 weeks ago,
Yeah,
into Washington?
it's not been that long ago, just recently.
And so, right now it's starting to obviously start compounding here in the U.S. What should people be afraid of? Like, what are the fears around this thing? What's real and what's not real?
Right. So the news obviously is gets sensationalized quite a bit. So I want people to really just step back and not get kind of caught up in all the fear. So yes, you know, corona is something new, and we need to be aware and do take precautions like we would do anytime when there's an outbreak. So, you know, we think about influenza, right? Influenza has been around for a really, really long time. That's the flu. That's
right.
the name that we call it medically. And it's been around for a really, really long time, and we see it every year. We see peaks of it every year. So just in this season alone, we've seen 34 million cases of influenza.
Wow.
350,000 hospitalizations for influenza and about 20,000 deaths. That's just here in the U.S.
Wow.
Right, so just kind of step back for a minute. Do you get freaked out about the flu? No,
Yeah.
You don't get freaked out about the flu. Does it kill people? Yes, it does. So what would you do if you felt like you had flu-like symptoms and you started feeling sick? Well, you'd stay home.
Yeah.
Right? You'd take all those proper precautions of getting your rest, drinking your fluids, controlling your symptoms. If you were really worried you were having some difficulty breathing or some other towards symptoms, what would you do? You'd reach out to your doctor to get advice, right?
Right.
So it's a similar kind of thing where we're, you know, encouraging people, if you're not feeling well, you stay home.
Yeah.
Right? Get the rest that you need. So I think people need to kind of step back a little bit and maybe not to freak out quite so much. Yeah, we're worried about people getting it, especially people who are older. And that have compounding medical illnesses, right? So I've got cancer, I might be on a immunosuppressive medication, asthma, COPD, things of that nature, that are going to be more at risk of having significant respiratory issues.
But they're at
with it.
risk for everything, right? Like I mean, most things. If you're older and you've got other issues already, I mean, influenza can take you out too, right?
Absolutely. And so that's why we always encourage people to get their flu shot, right? So we think about influenza, and I'm going to be on a big influenza soapbox here because we see so much of it, is that there's three things with influenza. We have a vaccine for that.
But there's no vaccine for coronavirus, right?
Not yet. There's not yet. But we do have a vaccine for influenza. I would really encourage people to go get your damn flu shot.
Yeah, yeah.
Okay. Am I allowed to say that on
Yeah.
the GSD show?
Yeah,
I'm
it
allowed to
says for
swear?
get shit done. Yeah,
Okay.
totally
Okay.
swear.
So I would really encourage people to go ahead and get their flu shot because that's the main thing that we're seeing right now. So let's try to prevent that because heaven forbid you did get both things at the same time. You'd be really, really sick, right?
Oh, you can get influenza and coronavirus at the same
Sure.
time.
I would think that you could. You know,
Yeah.
I'm.
Do we see any cases of that?
I haven't heard exactly of that just yet, but you know, you can get two things at one time, right? So you can get influenza, and then you can get bacterial pneumonia. Same thing with, you know, corona. You could also get pneumonia with what we call a secondary infection with that. So I'd really encourage people, go get your vaccine, right?
Yeah.
And don't be silly about it. It's not going to give you the flu. We hear that all the time. I got sick after getting it. Well, it didn't give you the flu. I can guarantee you that. And then we also have treatment for it too. So if
Okay.
you feel like you're having flu-like symptoms, you can be treated with medications like Tamiflu for that. So I just would really, really encourage people. We have a test for it as well too, what we call a point-of-care test that can be done in the office.
Perfect.
Yeah.
So when you've got, let's say, going back to coronavirus really quick, it was like, I think 3.4% death rate versus flu was like 0.5% or something like that. I think that's what I saw.
I
Is that
think it's a little bit higher than
higher
that.
than 0.5?
Yeah.
Well,
yeah.
do you know what it might be?
I think it's around 2 or a little less than 2.
Okay, so it still is less than coronavirus, but I think one thing that sways the numbers, kids can get the flu easily versus coronavirus, like there's only 2.8% of cases have been children, and it was only in China I saw.
Yeah.
Is that right?
Yeah.
So-
So right now, the incidence seems to be swayed more to the more adult and elderly population.
And
yeah.
because it's older and their immune systems are weaker and they've probably got stuff, the death rate might seem higher, maybe because there's no kids involved in this.
Yeah, I that makes empiric sense. Yeah.
Yeah. So with members right now of these fitness studios, they're, especially in certain areas, depending on where they're at, they're not wanting to come in.
Yeah.
They're freaked out about coming into the studio because they don't want to get sick. So what are some things that a studio owner or a business owner can do to either A, put them at ease, or B, take the proper precautions to make sure that it is a really safe, clean environment?
Right. So certainly I would have them reach out to their membership and let them know that they are cleaning and disinfecting their equipment on a regular basis. And we do know that with corona, you can effectively kill the virus by cleaning properly. Okay.
Really?
Yeah.
Okay.
So Lysol and any kind of antibacterial can actually kill the virus. So wiping down their equipment on a regular basis. You know, if they have a session, a class, you would encourage them to wipe down all their equipment after each class. And you know, some people are saying, you know, no high fives and all that kind of stuff. I mean, I suppose you do that where you're not having touching between people.
Right.
I honestly think that's a little bit excessive, but making sure that you're taking the cleanliness precautions, and then encouraging their members, if they're not feeling well, to stay home.
Yeah,
Right.
yeah.
So, you know, the last thing you want to do is to have somebody that's not feeling well to come and work out or come to work or something like that. And that kind of goes for any kind of illness, right?
Yeah. Dr. Oz says 80% of us who get it may not even realize we're sick. So from what we kind of looked into too, there's like an incubation period of like possibly 4 days or longer where you could have it but not feel sick yet. and you could still be contagious while having it. Is that right?
So they think primarily right now the most infectious stage is when you actually are symptomatic. As this evolves and we start to learn, there may be a period of time that's before that where you could be infectious but not realize it. And that's the same with influenza. I don't know if anybody here has had influenza, but the onset would be probably similar to that, where you feel sort of a sudden onset of symptoms.
Got it. Okay.
Yeah.
And then for all of you guys too, we're taking all the information that Dr. J has shared with us, and then also we put a list here together of things that we've just kind of gotten some research on what could be done to help prevent it. Let us know if you agree with these, because we've actually created a checklist, a sheet for you guys that you can download for free. One, wash your hands often with soap and water for at least 20 seconds and help young children do the same. If soap and water are not available, use an alcohol-based hand sanitizer. Wash your hands, especially after coughing and sneezing, before and after caring for an ill person, and before preparing foods and before eating.
Yep, that all sounds really good.
Cover your nose and mouth with a tissue when you cough or sneeze, and then throw the tissue in the trash. Avoid touching your eyes, nose or mouth with unwashed hands. Avoid close contact, such as kissing, sharing cups, or sharing eating utensils with people who are sick. Clean and disinfect. Frequently touch surfaces and objects such as toys and doorknobs, especially if someone is sick. Stay home when you are sick, except when you need to get medical care. Wash hands after animal contact and after visiting farms, markets, barns, petting zoos, and agricultural fairs. Avoid contact with animals who are sick.
All good advice.
All good advice.
Yeah.
Okay. So guys, if you go to thegsdshow.com/coronavirus, you'll be able to get that list as well, so that you can, at least have that list out there, and you can share it with your employees, with your with your members, all that as well. Okay. So what else? Is there anything else I should know? Like, is there anything that I could be doing or should be doing, or is this, another doctor we looked at called it like a mild illness?
Yeah, and from the reports that the CDC has put out, we think, over 80% of those that do get infected will have just a milder form of that illness, right? So a lot of people are very worried that it's, a deadly kind of thing. Well, that's not necessarily the case, right? So, when you're feeling well with a viral type illness, it's just doing all the common sense kind of things, making sure you get your rest, your fluids, control your symptoms, and then also stay at home as well.
Yeah. What do you see the future of this thing being? Do you see it escalating before it comes down, like getting worse before it gets better? Or do you see do you think we're peaked? Where do you think we're at?
I think we'll probably see a little bit more going on. My gut is that it's not going to last a super long time, but I'm sure we'll probably see it sort of go up and then kind of come down towards the end of the year. What we've seen in the past with kind of newer viruses is that they seem to be more virulent at the beginning and then sort of lose that as it kind of spreads out into the community.
Okay.
Yeah.
And what are your thoughts on people that are walking around with masks and rubber gloves and plastic shirts and all the stuff we're seeing out there? What is that helping you from getting it?
Okay, so the thing with the masks, the only people that should be wearing masks are those that are ill, all right?
Okay.
So by wearing a mask, you're helping to lower the transmission of your droplets to others around you, okay? If you're well, you shouldn't be wearing a mask. It's not going to help you, especially those regular surgical masks. They are not going to help. People who should be wearing a mask, the N95 mask, are people who are healthcare workers, okay? Who are being exposed and caring for those with the coronavirus.
Got it. So now, why doesn't it work? Like, it makes sense. Like, I'm covering possibly droplets from filtering into my face, right? Or why doesn't it work?
Right, so it's a droplet type of mechanism. So you could still touch your eyes and contaminate yourself.
Oh, so you get your eyes, your ears.
It's going to be your eyes, your nose, and your mouth. Obviously the masks are not really super well fitting as well too. Okay, so the droplets could transmit through, and certainly through to your eyes as well.
And what about the rubber gloves?
Yeah, so again, the rubber gloves I think is a little bit overkill. So,
I mean, as I see people touching their phones with their gloves and they just keep wearing the same gloves, at the end of the day, it might as well be their hands, right?
All right. Yeah.
Okay, so there's no point in it.
There is no point.
The mask if you're sick, so you don't have a higher likelihood of getting it out to other people.
Correct.
Other than that, if you're traveling, just take the proper precautions, wash your hands and your actually just wash your hands over and over,
Yeah.
and then just avoid contact with people that look like they're coughing, sneezing, that kind of stuff.
That's right. And we
What do
really
you do if you get caught sitting next to a person on a plane that is coughing and sneezing?
Well, I would ask them to make sure that they cough in their elbow, just to say, hey, man, could you just make sure you take the precautions to keep all of us around us safe?
Yeah. Do you
and-
carry Lysol wipes when you travel to make sure you wipe down all the handlebars?
I have not, and I just recently traveled. I just came back from Washington, D.C. The lady beside me actually handed me wipes and Purell to disinfect myself, probably because she was worried about me. But, planes are, a lot of people touch planes and the trays and the seats and everything.
Right.
So, should we have been using all of these precautions for a long time just to keep ourselves healthy? Probably, right?
Yeah. But now we're just extra freaked out.
We're all freaked out about it.
Okay, so overall, it is not as serious as we all think. There is some seriousness to it, of course. We definitely want to pay attention to what's going on, but ultimately, it's not like this virus that's going to be Armageddon. It's kind of a mild illness that's going around. It's a little bit worse than the flu, but not really in a lot of other ways.
Well, I think we'll learn as things evolve. For the most part, we think it is a milder illness that people will recover from just fine. We're worried about people with pre-existing conditions and the elderly.
Got it. Perfect. Okay, Dr. J, thanks so much
You're welcome.
for helping us with this. We wanted to be able to get some stuff out. Guys, go to the gsdshow.com/coronavirus. We'll send you the checklist of things that you can do to help prevent getting it, spreading it, and you guys can share that with your team, your coworkers, your members, all that stuff too. Thank you so much for being on the show. And for
welcome.
everybody here, we will see you on the next episode. Thanks for watching. If you like this episode, make sure you subscribe to our podcast on iTunes, Spotify, SoundCloud, Google Play, or YouTube. And to watch more episodes and get exclusive links from each episode, go to gsdshow.com. Again, that's gsdshow.com.